Hi, my name is Roxanne, and this is my presentation on health education for nutrition and asthma. I'll discuss the two health-related problems that I made my presentation on, nutrition for the older adult and asthma. And the goal I wish to achieve for these two health-related problem interventions is to improve quality of life. I believe that these two concepts have a substantial impact on the quality of life in the underserved community that I am working with. So background and significance of nutrition for the older adult. Nutrition is the study of nutrients in food, how the body uses nutrients, and the relationship between diet, health, and disease. Everything we eat and drink matters because it provides us with energy to do our daily tasks. And as we get older, our bodies have different needs, so certain nutrients become especially important for good health. Building a healthier eating style can help you avoid becoming overweight and obese and reduce your risk of diseases such as heart disease, diabetes, and cancer. Some facts. About 90% of Americans eat more sodium than is recommended for a healthy diet, and U.S. adults consume an average of 3,400 milligrams a day of sodium, which is well above the current federal guideline of less than 2,300 milligrams. Background and significance of asthma. Asthma is a chronic lung disease that inflames and narrows the airways. The airways are tubes that carry air into and out of your lungs, so the inflammation makes the airways swollen and very sensitive, causing less air to flow into the lungs. They experience symptoms such as wheezing, chest tightness, shortness of breath, and coughing. And some facts, in the United States, more than 25 million people are known to have asthma, and asthma has no cure, but most people who have asthma are able to manage. Healthy People 2020 objectives. In Phase 8 outcome evaluation, I created long-term goals that will address each of the educational interventions. Nutrition for the older adult. After 1 year post-presentation, each participant will have reduced his or her consumption of calories from solid fats and added sugars. After 1 year, each participant will have increased his or her fruit consumption by 15%. And for asthma, after 1 year post-presentation, each participant will have increased their knowledge of asthma triggers and methods of prevention and treatment in order to reduce activity limitations, as well as each participant will have received formal patient education through a medical visit. And I'll not be able to evaluate these long-term goals since they are expected to take effect a year after giving the presentation, but if possible, I would try to send a survey by mail and email to the participants to measure if they have implemented interventions in their daily lives. Theoretical framework and needs assessment. First, I'll go through the pre-seed portion of the model. So Phase 1, defining the outcome. I knew the goal of my project was improved quality of life, and in order to achieve this, I had to understand all possible aspects of nutrition as well as asthma. So I began obtaining information from online resources as well as in investigation questions through community surveys and questionnaires. Phase 2, identifying the issue. Here I analyze the factors influencing nutrition in the older adult and asthma. Such factors include behavioral, lifestyle, or environmental factors that I will discuss later on in the presentation. Phase 3, examining the factors. Once these factors were analyzed, I had to further examine the reasons that a person would struggle with reaching these desired goals, such as predisposing, reinforcing, and enabling factors. Predisposing factors include a person's knowledge of nutrition and asthma, his or her attitudes, beliefs, and values and perceptions regarding these concepts. Reinforcing factors include rewards and feedback the person receives from adopting a desired behavior, enabling factors include skills, resources, and barriers that can influence change. Phase 4, identifying best practices. This is the stage where I began to think more in depth in my presentation. I had to figure out the best way to present the material through direct communication and indirect communication. I had to make sure my goal was in line with the organization of Red Cross. And it also appeared that I had a lot of flexibility with my teachings and there was no policies that were enforced. A big problem, though, was the amount of participants that would be at my presentation. So I had to advertise the class with flyers and incentives for participation. Next, I'm going to do the proceed portion, Phase 5, implementation. I created a lesson plan for the day that outlined the topics I would cover in both the classes, as well as a PowerPoint presentation that the participants would be able to read and follow along with. Phase 6, process evaluation. I created objectives to evaluate whether I have succeeded in achieving the steps I planned in order to have these classes. Objectives include scheduling the dates for the classes, creating all teaching materials and teaching plans, rehearsing the talk, and setting up the room for the presentation and performing a full run-through. Phase 7 is impact evaluation. I created short-term objectives that would assess the implementation of my classes and the ability of these classes to impact change for improvement. I'll discuss these short-term goals later on in the presentation. Then phase 8, outcome evaluation, I created long-term objectives that would evaluate if my class interventions successfully worked to impact change and an improved quality of life for the participants. And I'll also discuss these long-term goals later on in the presentation. Issues for nutrition for the older adult. Factors that affect nutrition as well as asthma include behavior, lifestyle, and environment. So behavior is the way in which one acts or conducts oneself. So problems include being too lazy to implement proper nutrition and not making enough time to make changes. So you could fix this by having more motivation and dedicating time daily and weekly to make changes. Lifestyle is the way a person lives on a daily basis. Problems include diet high in calories and fats, and no calorie counting, and not paying attention to proportions. And you could fix this by having a balanced diet and not overeating. Environment, the surroundings or condition a person lives in. Problems include access to groceries, ability to purchase groceries, and you could fix this through food assistance programs, food banks, low-income grocery stores, and food stamps. We're going to discuss these same factors with asthma. So for behavior, problems include being uninformed, too lazy to implement proper treatment, and not making enough time. So you could fix this by educating yourself, having motivation, and dedicating time daily and weekly again. For lifestyle, problems include experiencing symptoms during certain activities, and you could fix this by knowing what your symptoms are and how to treat and prevent them from occurring. Environment, problems include being in an environment with asthma triggers and having access to proper medical care. And you could fix this through avoiding asthma triggers, preventing asthma flare-ups, and low-income treatments. Interventions. Again, the objectives for nutrition for the older adult. After 1 year post-presentation, I'd hope that each participant would have reduced his or her consumption of calories, as well as increased his or her fruit consumption. And then the objectives for asthma. After 1 year post-presentation, I'd hope that each participant will have increased their knowledge of asthma triggers and prevention and treatment, as well as received formal patient education by visiting a doctor. And these interventions are based off of learning theory, and the principles are explaining how individuals acquire, retain, and recall knowledge. Everyone learns differently, so it's important to understand the learning needs of the audience in order to create such presentations. So behaviorism focuses on a new behavioral pattern being repeated, and the learner depends on an instructor for acquisition. So for me, this was pretty much me giving the talk and giving my participants the information. Cognitivism is based on the change in behavior through development of an individual's cognitive abilities. And for me, this was having a discussion with my participants and asking them questions. Constructivism focuses on construction of knowledge when information is mixed with the knowledge acquired by experiences. And for me, this was seeing the participants brainstorm personal interventions in ways that they can impact change into their lives. Next, the budget. Going into this project, I didn't have a budget limit, nor did I expect to need many resources to pull this off. And when I spoke with my organization contact, she also didn't provide me with a budget. I didn't need any organizational or logistic support, and as long as I had access to the room, I'd be able to set up and provide the class as needed. So the expenses, which was not very much, informational flyers, snacks, and then refreshments that I provided at the end of my classes. Project evaluation and outcome measurement. Like I stated in the beginning of my presentation, the goal of this project was to improve quality of life for these participants. I discussed my long-term goals and achieving Healthy People 2020 objectives in the prior slides, so I'm going to discuss my short-term goals. So nutrition for the older adult, by the end of my presentation, I wanted 75% of participants to state one community resource that can help improve their nutrition, as well as 2 ways they can improve their daily nutritional intake. And for asthma, I also wanted 75% of participants to describe various asthma symptoms, as well as describe 2 ways that they can prevent or treat their asthma symptoms. Results and conclusions. By the end of my presentation, 75% of participants could state all those objectives. Some weaknesses, I only presented 2 classes, and my audience is only a fraction of the total community. So while I found it informative, my presentation can only provide so much information, and it's truly up to the participants to enact the changes we discussed. I believe my presentation will only impact a small dent into the larger issue of improved quality of life. And if I could start the process again, I would provide more classes to a larger variety of audiences, more locations, and on multiple dates. And for my strengths, I thought there was a really good turnout of participants. And I received feedback that it was easy to follow and organize, and the participants just thoroughly enjoyed the presentation. So here are my references, and thank you so much for listening.